Hi, my name is Dr. Sandra Clear, and I'm the Vice President of the New Zealand Association of Medical Herbalists. I would like to talk to you today about why we as a professional organisation are lobbying right now the New Zealand government to ask them for their support to accept medical herbalism as an allied healthcare profession in this country. Like everywhere else in the world, we would like medical herbalism to be a choice that people have when it comes to their health. Now, plants and humans have a very long co-evolution. We wouldn't be able to live on this planet without plants. Plants provide us oxygen, food, shelter, electricity, to name just a few things. And of course, it's no surprise that plants are also the first medicine that this planet has ever used. It's the oldest system of medicine for human mankind. And when we look at a survey of the WHO, about 80% of the world population still use plants as medicines for their primary health care. That's roughly about 5.6 billion people. And why is this? It really is around the familiarity of these types of therapeutics. It's about their safety and also about their efficacy. And scientific research increasingly is validating these medicines, be it for stress relief, to be able to sleep, for anxiety, improvement of immune systems, improvement of menstrual cycles, for headaches, eczema, just to name a few things. So they are really remedies that have been around for a very long time with a very good track record. Now, in New Zealand, we are unfortunately lagging behind other countries where herbal medicine is really part of primary health care and is also funded in many countries. So our application with the New Zealand government has been languishing for quite a few years now. And we're just trying to really progress this application so that we become accepted as allied health professions. Now, we would like to encourage you to go to your local MP and support our application and basically point out how important it is for people to have choice. Thank you very much for your support.
Hi, I'm Brett Elliott, medical herbalist with 22 years of clinical practice, and I'm speaking to you today on behalf of the New Zealand Association of Medical Herbalists, and also on behalf of the millions of New Zealanders who value access to traditional herbal medicine. Herbal medicine's been around for thousands of years, and studies have shown that even today, up to 50% of adults and 70% of children rely on natural medicines for their primary health care. And in particular, plant-based medicines are the most popular. There's a big difference between over-the-counter supplements such as vitamin C and fish oil and things you can buy in the pharmacy or the health store, and professional prescribed herbal medicines which are prescribed by a qualified practitioner. So these herbal medicines are far more potent and far more powerful than what you can buy over the counter. And that's why they need to be regulated, and that's why we need a professional body such as the New Zealand Association of Medical Herbalists to regulate and register the practitioners. And it's also why we need the New Zealand government to register the profession so it can be properly regulated. During COVID-19 lockdown, medical herbalists were not classified as an essential service, and this meant that the many tens of thousands of New Zealanders that rely on prescriptions from their medical herbalists couldn't pick up their repeat or their formulations, putting their health at risk. Many of these patients rely on these medicines to maintain their health in place of the pharmaceutical drugs or alongside their pharmaceutical drugs. So again, this puts a real emphasis on the fact that we need to regulate the profession, we need to register and recognise practitioners, and the application that the NZAMH have put forward to the New Zealand government needs to be processed and progressed. The New Zealand Association of Medical Herbalists has made multiple applications to the New Zealand government to have the profession registered so that practitioners can be recognised as an essential service and as part of the primary healthcare system, part of mainstream healthcare, in fact. And if you want to have your voice heard on this subject, please share this video with your friends, and also you'll find next to this video some bullet points which you can share or make into a letter that you can write to your local MP, or make a call to your MP on the subject. Thanks for watching.